Topic is Stomal Mucosal Prolapse. Hello dear students, we'll discuss about this condition. Just have a look in this post-operative complication. Look there, this patient has undergone some stoma, probably ileostomy. So find out, or colostomy, probably ileostomy. Find out what is colostomy, ileostomy, stoma, causing mucosal prolapse. See that mucosa has come out like this much length. It's one of the common complications. Parastomal hernia is a common complication. This is one of the again common complications of ileostomy or colostomy. So stromas are stroma, colostomy, ileostomy, short note, end stroma, loop stroma, temporary stroma, permanent stroma, double barrel stroma, like this it becomes. And Divines is in between two skin bridge will come. Divines double barrel stoma. Divines colostomy, there is a Divines double barrel colostomy. It is diversion, temporary diversion. If there is a anti-resection or sigmoid resection for infective in the infective field, then you do ileostomy stoma. So that after 3 months you can close it. And permanent is in abdominal resection, permanent end colostomy will do. So that is a permanent colostomy. Indication carcinoma, obstruction, many other diseases we can do, stoma or colostomy or ileostomy. So right hypochondriac region you can put colostomy, loop, double barrel. These are different areas. Left iliac fossa mainly sigmoid or descending colon. Right iliac fossa mainly ileostomy. Temporary permanent ileostomy, permanent end ileostomy will do. Temporary usually loop ileostomy will do. So ileostomy, that is the stoma usually. So complications are parastromal hernia, commonest one, mucosal prolapse common, stenosis, colitis, apparent infection, bleeding can occur, skin extrusion, diarrhea, necrosis, bleeding from the mucosal stroma is not uncommon, remember. All these things are the complications. Parastromal hernia, surgical repair. Again, mucosal prolapse persists and distressing. Sometimes the mucosal alteration occurs, ischemic necrosis occurs. Then we have to redo the stroma. So this requires surgical intervention, remember. So answer them, must this procedure is used in discrepancy in size of ileum and stroma. Ileostomy prolapse, ileostomy leak, ileostomy stenosis, correction. Students, please find out the right answer. I'll get back to you later. Gyro technique is used in ileal resection, colostomy, ileostomy, ileocolic anastomosis. Again, find out right answer. I'll get back to you later. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis, but it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons, all procedures including major surgery, GI surgery, general surgery, thyroid, breast and other things, include briefly gynecology surgeries, with step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that in detail. Explanations are there. My small atlas of tissue approximation with the videos shows clearly means with the principles how to suture tissues. Dissection and tissue approximation, there are two parts in surgery. Dissection is the principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that very, very useful thing for to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP Publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It do detail thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much. So students, I hope you understood stoma very well. Stoma is a very common short note. Colostomy, indications, complications, different types of colostomy, MCQ question. Ileostomy also same, different indications, technique briefly and complication. Please read my manual. It gives a very detail about this stoma management, stoma care is the short note, everything you should know. So I hope you understood brief lecture very well. Thank you so much.